they are separated from one another by this end of the femur and this end of the femur. They are separated from one another by what? Pelvis, isn't it? So the distance between the two bones would be more in male or in female? Why? Because the female is, the pelvis is more broad in female. Okay? Alright. Okay. Now you come to the shaft. You look, the shaft almost cylindrical and it is bowed anteriorly. It is not straight, but it is bowed anteriorly, and it consists of the anterior surface, the lateral better to be posterolateral surface, the medial and better to be posteromedial surface. Look at the anterior surface, which is bounded laterally by the rounded lateral border and medially by the rounded medial border. The anterior surface, which is bounded laterally by the rounded lateral border and medially by the rounded medial border, this anterior surface at the upper end where there is intertrochanteric line, over here the anterior fiber of vastus lateralis, and over here on the medial side the anterior fiber of vastus metalis. Otherwise, whole of this anterior and lateral surface, this is being reserved for the attachment of vastus intermedius muscle. Vastus intermedius muscle, it is reserved whole for the anterior and lateral surface. In the lower part, just above the knee, few slips from this area over here is for the attachment of articularis genu muscle. So this anterior surface wholly is reserved for the vastus medialis, and in the lower part there is the attachment of articularis genu. The lateral surface, which is being bounded by the rounded lateral border and then bounded by this rough ridge, which is called as posterior border, or also called as linea aspera. This in an anatomical position facing posterolaterally. That's why it is not completely lateral, but it faces partially posteriorly as well. This doesn't bear any attachment for any muscle. It is only covered by the vastus lateralis, which originate from the lateral lip of linea aspera. It only covers it but gets no attachment for this muscle. And fibers of vastus medialis, of course, they are also coming onto the lateral surface, but the vastus lateralis only lies on it. Vastus lateralis originate from the lateral lip of linea aspera, and the fibers are then coming like this. All right. The medial surface, which lies between this rounded medial border and again between this posterior border, it is actually facing posteromedially, not exactly medially. Okay, and it lies between the two, and this has no attachment of muscle, and only the vastus medialis, which comes from the medial lip of the linea aspera, that covers this medial surface but gives attachment to no muscle. All right. So from the anterior surface and lateral surface, vastus intermedius. From the medial surface, no muscle. Attached, only covered by the vastus medialis. Understand? And from the lower part of anterior surface, articularis genu. Then when you come to the posterior side, look. In the middle third of the shaft of the femur, it consists of anterior surface, posterolateral and posteromedial. But in the upper part and in the lower part, on the posterior side, the femur consists of the fourth surface as well. Alright? And in this upper part, the fourth surface, which is triangular, it is bounded, look, on the medial side by a line. This fourth surface on the upper part of posterior surface, it is bounded by a line which is continuous with the intertrochanteric line, and this is being called a spiral line, which is continuous above with the intertrochanteric line. In below, it is continuous with the medial lip of the linea aspera. Above with intertrochanteric line, and below with the medial lip of linea aspera. And this ridge or line, this is being called a spiral line, and it forms the medial boundary of this posterior fourth surface. And the lateral boundary of this surface on the upper end of the femur, it is being bounded by this rough ridge, which is called as gluteal tuberosity. This rough ridge, which is wrongly called as gluteal tuberosity because it is not a tuberosity but it is a rough ridge. It should be better called as gluteal ridge. Alright? Now, to the gluteal ridge or gluteal tuberosity, there is the attachment of gluteus maximus. And to the spiral line, in continuation, there is the attachment of the fibers of vastus medialis, which then lower down is being attached to the medial lip of linea aspera. So vastus medialis originate from this lower part of intertrochanteric line, then in continuation it originates from this spiral line, and then it originates from the medial lip of linea aspera. And look, this triangular area which is bounded by this gluteal ridge and by the spiral line, in the upper part of it lies this lesser trochanter. And attached to the lesser trochanter is iliacus and psoas. And to the area below that, there is the attachment of pectineus. And later to that, there is the attachment of adductor brevis. So in this triangular area, below the greater trochanter, there is the attachment of pectineus and adductor brevis, and to the gluteal tuberosity by itself is attached gluteus maximus, and to the spiral line there is origin of vastus medialis. Okay, and then lower down again there is a small triangular area which is also called as popliteal surface of femur, and it is bounded by a ridge on the medial side which is being called as medial supracondylar ridge, and on the lateral side by a ridge which is being called as lateral supracondylar ridge. And you can see these two ridges, they are the continuation of the medial and lateral lip of linea aspera. And this popliteal surface of femur, it is being covered by a lot of fats, which is called as popliteal peda fat. And lying over the fats, if you remember from the dissection of popliteal fossa, is lying over the fats or popliteal artery, popliteal vein, and the sciatic nerve, and their divisions and their branches. Alright? Okay. Now, if you follow this medial lip of linea aspera, it becomes prominent to form the medial supracondylar ridge, and at the lower end there is a big tubercle which is called as adductor tubercle, and to this adductor tubercle are being attached the lower fibers of adductor magnus, and to the medial lip as a whole is attached the vastus medialis and adductor magnus both. To the medial lip of linea aspera, you look, this rough ridge is being called as linea aspera. It consists of this lateral lip and this medial lip. And to the medial lip is attached from above. You can see the continuation of vastus medialis, and then is the insertion of adductor magnus till the adductor tubercle. And to the lateral lip, there is attachment of adductor longus, biceps muscle, and vastus lateralis. Over here, there is gluteus maximus, then is adductor longus, then is the femoral head of biceps, and then whole is the vastus lateralis. Medially, vastus medialis and adductor magnus. Between the two, over here is pectineus and adductor brevis. Alright, you remember it. At this time, you may not understand, you will be a little bit confused, but think it's easy. Okay? And to the adductor tubercle is being attached. Alright. Okay.